Let's begin the second section, and in this section we will talk about some host defense mechanism which can be effective in preventing the infectious diarrhea, and these are the microbiota, intestinal microbiota, gastric acid, and also the intestinal motility and immunity, and the genetic determinants associated with the host defenses. So the intestinal microbiota, here if you see, these are all the intestinal microbiota present. The important host defense mechanism prevent the colonization by enteric pathogens and the risk of developing infections if the flora is underdeveloped or if the person is taking antibiotic. So the normal flora of the intestine is very important host defense mechanism. But if person is taking antibiotics and antibiotics are functioning against the microorganism, it affects the normal flora also. So it's common sometimes people who are on antibiotics, they develop the diarrhea, and now we know the mechanism because the normal intestinal microbiota is affected, decreased by the or underdeveloped by the in the person who is on antibiotics. So the very important factor in the protection or against as a defense mechanism is the presence of intestinal microbiota. Then the important factors are the composition of flora and the number of organisms present. Less than 99% of normal microbiota has anaerobic bacteria. So more than 99%, not less than 99, is the anaerobic microorganism, anaerobic bacteria, which are the bacteria that are grow in the absence of oxygen, anaerobes. So more than 99% are anaerobic bacteria. Acidic pH, volatile fatty acid production, element in resistance to colonization. So these are some important factors which are associated with the normal microbiota of intestine, that they have acidic pH, volatile fatty acid production, and these are the elements that involved in the resistance to colonization. That's how they prevent the colonization of pathogenic microorganisms. Gastric acid is barrier to enteric pathogen. The acid present in the stomach, that's gastric acid, it is also a defense mechanism against the pathogenic microorganism. Increased frequency of infection occurs if there is a decreased gastric acid. If the person is achlorhydric, means no acid, or if they have the gastric surgery performed that lead to the achlorhydria or decreased acid, that can be the cause, leading cause for the development of pathogenic microorganisms. Increased infections by Salmonella, Giardia lamblia, variety of helminths occur if there is decrease in the gastric acid production. Gastric acid, neutralization of gastric acid occurs with the antacids, proton pump inhibitors, and H2 blockers. So if there is increased secretion or gastric acid increase is present, it is neutralized by, these are the common drugs that neutralize the acid. And we already mentioned that the person who has less gastric acid, they are more prone to colonization by pathogenic microorganisms. So indirectly, these drugs, patients who are taking these drugs for decreasing the gastric acid production, they are more prone to infections. This is the esophagus muscle that closes to prevent acid reflux, stomach and food and stomach acid. Increases risk of enteric colonization. So as I mentioned, if the person is taking the drug which neutralize the gastric acid, they are more prone to develop the infection. Some microbes are stable to acidity like rotavirus. Acid has no effect on rotavirus, so they can cause disease no matter if acid is present or not present, or if it's enough in amount or not. Next, the intestinal motility. Movement of the intestine is also very important factor in preventing the colonization or growth of the microorganism. Normal peristalsis is the movement of the intestine, common bacterial clearance process. So once the intestine move or there is peristalsis, it can clear the microorganism from proximal small intestine. Impaired motility, what happens, it increases the frequency of overgrowth, infection of small bowel with enteric pathogen. So if the decreased motility is present, then it can cause increased infection by the pathogenic microorganism, because now the mean of clearing the microorganism like peristalsis is not present. Next, patients undergoing treatment for Shigella infection, use of diphenoxylate hydrochloride with atropine, prolonged fever, shedding of organisms. Patient undergoing treatment for mild salmonella gastroenteritis like opiates, higher frequency of bacteremia compared to ones not treated with opiates. So these are some effects. If their patients are getting treatment for Shigella and salmonella, they usually have prolonged fever, prolonged infection, prolonged shedding of organism, and similarly for the salmonella treatment. Now the immunity, another defense mechanism, antibody production. The immune system of the person is the system that is responsible for the infection caused by different pathogenic microorganisms by the production of antibodies against those organisms. So antibody production protect from infections. Humoral immunity, which is systemic IgG and IgM, and secretory IgA is responsible for humoral immunity. Then mucosal immune system is the first line of defense against gastrointestinal pathogen. In the first section, I mentioned that the microorganism adhere to the mucosal wall. So if there is immune system present in that intestinal mucosal lining, it protects against the infection. Immunity, again, what happens and how it works, the antigen binding to luminal surface of M cells in distal small intestine, presentation of antigen to subepithelial lymphoid tissue, proliferation of sensitized lymphocyte, and then lymphocyte circulation as IgA secreting plasma cells. And these populate all mucosal tissue. Plasma cell lead to the formation of antibodies. So binding to the antigen lead to the proliferation of lymphatic tissue, lead to the formation of plasma cell, and that's how it protects against the infection. Some genetic determinants, which are the defense mechanism or host defenses. We have some genetic variation also predispose the person to diarrheal diseases. These are the people who have blood group O. They have increased susceptibility to diarrhea, especially by the Vibrio cholerae, Shigella, E. coli, and norovirus. So one genetic determinant, which is the blood group O, is more prone, more susceptible as compared to individuals who have blood group A, B, or AB, people who have blood group O. Polymorphism, poly is multiple, so different changes that can be associated, polymorphisms in genes encoding inflammatory mediators, infection with enteroaggregative E. coli, enterotoxin producing E. coli, salmonella, and Clostridium difficile and Vibrio cholerae. So polymorphism, if it is in the genes encoding inflammatory mediators. So if there is changes in genes which code the inflammatory mediators, they are more prone, or polymorphism is more associated with infection caused by enteroaggregative E. coli, enterotoxin producing E. coli, salmonella, Clostridium difficile, and Vibrio cholerae. So that was all about section 2. Thank you for watching sqadia.com.